Okay, thank you. Please let me know.
All right, we have started recording. Give me 1 second. We are now live.
Good afternoon. Welcome to the YWCA's Talk on Health. This is an event done in collaboration with the Lower Cape Fear YWCA and the Wilmington chapter of Delta Sigma Theta Incorporated. We are glad to have you here with us, and we hope that you will engage with us and ask us questions, and that you learn a lot about the COVID-19 vaccine. I will first begin with a land acknowledgement by the YWCA. The YWCA of Lower Cape Fear serves the people located within the Lower Cape Fear region. This land once thrived with life from indigenous peoples, known today as the Cape Fear Indians, and the Waccamaw. Living in established settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of these places. Indigenous peoples are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst the backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Thank you very much. I am Dr. Lakeisha Jarrett, and I am a family medicine physician in Wilmington, North Carolina, and I will be moderating today's talk. The topic today is facts are not at war with your faith. Facts and faith. Let's get clear on the COVID-19 vaccine. I am so excited about our panelists today. We have Dr. Robert A. Wynn, who is a pulmonary specialist at the Virginia Commonwealth University Massey Cancer Center. Dr. Regina Miltier, who is a pediatrician, and Rev Dr. Charlene Matson from Price Cathedral AME Zion Church. I will allow each one to introduce themselves and tell what they're bringing to the table today. We'll start out with Dr. Wynn.
Well, thank you all for having me here. I'm Rob Wynn, was appointed the second ever African American Cancer Center director of an NCI designated cancer center in the United States. That's sad to say that since 1971, there are only two, and I'm number two in 2019. At VCU Massey, I not only do the cancer center, overseeing the research, overseeing the clinical trials, overseeing the clinical care, but since 2020 of March, I've also been the lead along with Pastor Gray from the Fifth Street Baptist Church and Rudine Mercer Hayes in developing what we call the Facts and Faith Friday. And we can talk more about that later, but thank you for having me here.
Thank you very much. Next, we'll have Dr. Miltier.
Hi, I'm so excited to be here with you this afternoon. I'm Regina Miltier. I am a pediatrician. Currently, I'm a senior medical director for the largest managed care organization in the United States. I've been with them for a few years now. Previously, I was in academic medicine as a pediatric hospitalist. I also am a proud member of Delta Sigma Theta Sorority Incorporated and sit on their national ERT task force that addresses COVID during this pandemic, as well as the National Task Force for COVID for the Links Incorporated. So I'm so happy to be here.
Thank you. We're happy to have you. And next we have Reverend Dr. Charlene Matson. Could you please introduce yourself?
Good afternoon. My name is Charlene Matson, and I am glad to be with you as well. I do pastor the Price Cathedral AME Zion Church, where we are very, very active in the community. Some of the things that we've done as far as COVID-related outreach, we've held COVID-19 testing at our sites. We've held flu vaccinations at our site. Of course, that's flu, but we've done quite a few activities to stay active in the community as it relates to COVID. Personally, I have had COVID-19 twice. The first time I contracted COVID-19 early on when it was really in the impetus. I got it in June, late June, early July. And recovered after 45 days, never had to go on ventilation, thank God. Then the second time I contracted it from a worker that comes in to assist with my son. My son has autism, and he was positive, and therefore I was positive, but fortunately my son was not. So as soon as I was able, I took the vaccine, and I expressed that to my congregation because I was probably one who thought that since I had it twice, what else could happen to me? But realizing that I'm involved with the public, I thought it was very important for me to be vaccinated so that I could continue my work with the public. I think it's very important that we continue to educate our population about the importance of the vaccine. Glad to be here.
Thank you. I'm so glad to have you. Thank you for sharing your story. I'm going to give a few facts about our county, which is New Hanover County in North Carolina. We have an estimated 1,495 active cases in our county, with 39 new cases at the University of North Carolina at Wilmington. The medical center has 90 persons hospitalized due to COVID, with 17 in the ICU. And these numbers are always changing. So I think these were from about a week ago. The county has a positivity rate of 14%. The loss of New Hanover County residents due to COVID has risen to a total of 226 people. 56% of our population is vaccinated, fully vaccinated. 61% of the population is partially vaccinated. Vaccines are available and free for everyone who is 12 years and older. And there is a mask mandate in effect in our county. So we'll start out with the questions, some questions that we've had. What does faith have to do with COVID?
So this is just something that just happened recently. My grandmother, who was born here in Virginia, recently visited me. She's going to turn 95. And I had just called her about some of my frustrations with people and what was going on. And I was just getting so frustrated. And I was like, what's wrong with people? And, she reminded me that faith has everything to do with COVID. In fact, she said, listen, if you had some people who didn't understand that when Jesus turned wine, water into wine, when he actually had the 3 loaves and the fish and fed the multitudes, and if you could only reach out and touch the hem of his garment, you'd be made whole. He goes, there's people then that didn't believe that. How you gonna get some of these crazy? She goes, there's just some people that ain't gonna believe. So this was around evidence, because I started talking about evidence. And she was like, well, if that wasn't enough evidence for people to believe then, you're not gonna get people just to believe the things of vaccines. Now, the truth of the matter is there's so much coming on the radio, and there's so much confusion, I think, being out there in people's mind, that it's getting people distracted that they don't even recognize a fact when they see it. It's almost like I've told somebody, this is like going back into the Orson Welles and when radio was in its infancy. And y'all remember that y'all probably, if y'all don't remember, this is a great story about how Orson Welles had this thing of the War of the Worlds. And then all of a sudden, you had people in Indiana and all around Mississippi just, it was a national radio show running out because they thought aliens had really invaded the planet. It's because we couldn't tell entertainment from reality. And Dr. TikTok and usually your radio shows are really blurring and making it difficult for people to understand entertainment from reality. So faith has everything to do even with science. In fact, Daniel was what we call what? Daniel was one of the first scientists. That's why you get the Daniel diet, right? It's an observation and evidence. But even then, people don't believe it. So even in science and everything, faith really is not at war with facts. And those who ultimately make it at war with facts aren't really trying to, I mean, I don't understand how to talk to them because, as my grandmother said, if people could see for themselves that touching the hem of his garment would make you whole and don't do it, how are you going to get these people to take the vaccine? I say that it's going to be continually putting, I argue to push back. I don't argue with my grandmother. That's for one. I don't argue with her. But I told her that I still think that regardless of what it is, we still just got to put facts out there. And at some point, the evidence is here. We can't get no more evidence. It's not about the evidence. It's about the consistent showing up and being consistent with our messaging and hoping that people will ultimately have the faith to trust what they see with their own eyes and the facts that's being presented in front of them. At least that's my 2 cents.
Reverend Dr. Matson, I know you have something to say about that. I saw you wanted to chime in, so unmute yourself and tell us what you're thinking.
Well, I have a scientific background. I have a BS in chemistry, a minor in engineering, a master's in an MDiv, and a DMin. And so I'm all over, you know what I'm saying? But what I will say is God gives us common sense. And we have to exercise common sense if we want to be healthy. If you are diabetic and the doctor has told you what you need to do in order to stay healthy, you need to do what the doctor tells you to do in order to remain healthy. If you eat so much sugar that it puts you in a diabetic coma, that's not his fault. It's your fault. I have a friend right now I do morning meditation with, and they're new in the belief. And so it's kind of hard to help them understand facts. So I have to make sure I gingerly remind these individuals when I'm talking to them, go check your facts before you start to tell other people, And one of the conversations we had this morning was about, we started reading a passage about forgetting about the past and focusing on the future. And this person had a really great job in the past, and now they have a job that's not paying so much right now because of health reasons. And they said, well, God put me in this situation. I said, no, you put yourself in this situation because they told you what not to do in order to keep your blood pressure low, and you did what you wanted to do, and then you had the stroke, and now you're upset because you can't do what you used to do. God gives us common sense. And I think the common sense is do what people are telling you to do. It's okay to trust science. I have a science background and a theological background. And I still believe God created some people to become scientists so that they could help God's people. So use your common sense. I'm going to be quiet.
No, I love that. And I especially love the fact that some people act like science and faith are mutually exclusive. And you are the embodiment of the fact that it is not. Thank you.
Thank you.
So the next question we have is, what does science say about the COVID-19 virus? And how do we explain it to the general population that struggles with understanding the virus and its transmission?
Dr. M, that's you.
Oh, I want to bring a different piece to this, and that is to talk about our children, because those are the ones you're seeing on the news now. Why are things changing? COVID is changing for children because we have opened up the world again and they're out in the world. The question that everyone is still asking, I even saw an MSNBC report today, and there was a speaker and parents wanted to know, can my children still be safe in school? Children need to be in school. That's where they have social development. Sometimes that's where they get peace. And for some children, that's where they get a good meal, breakfast and lunch at least. So children need to be in school. And it is our responsibility to make sure that they're safe in school. How do we do that? One, we follow the recommendations, and school systems are doing this, the recommendations from the American Academy of Pediatrics and the Centers for Disease Control. But it's not up to the schools to totally protect our children. We have to get vaccinated as adults. Only children 12 years of age and older are able to get vaccinated now. And so when children get COVID, it is usually because it has been transmitted from someone, an adult, to a child. Children stayed home for 18 months. They didn't go to school. And we didn't see the numbers that we are seeing now. So we have to, one, get vaccinated. Two, we have to wear our mask. We have to protect our children just like we do every day. You know, we make sure they're sheltered. We make sure they're fed, they're clothed. You say something about somebody's child and they are ready to fight you. You don't even have to touch the child. So we have to use the same vigor and protection against the COVID vaccine, especially the Delta variant. The pediatric ICUs are full. I just had an experience 2 weeks ago because of the pediatric ICU beds in North Carolina being full, that we had to fly a 4-week-old with COVID who was on a ventilator to Virginia for care because there were no ICU beds. Can you imagine that this 4-week-old was that sick? I just read a report today of a child who got encephalitis. She had inflammation of her brain. She's completely paralyzed, has been on a ventilator and in the hospital since March. And why? Because a parent brought COVID into the household and the parent wasn't vaccinated. So we as adults have to make sure that we protect our children, even if we're a little bit skeptical about the vaccine and wanting it and not wanting it and what's in it and what's not in it. We need to protect our children. You know, when we talk about what's in the vaccine, we're not sure. I know we're going to talk about some of the reasons that people don't want the vaccine. But, you know, when we pack up that little peanut butter and jelly sandwich and send it with our kids to school, we don't know what's in it. I don't. I mean, there's peanut butter, and what is peanut butter and what is jelly? But we're giving it to them and thinking nothing about it. You know, I did it for many years. My daughter must have taken a peanut butter and jelly sandwich to school for 3 years straight every day because that's what she wanted. So, you know, fortunately, she turned out okay for it. But, you know, we really need to be responsible for our children, not the schools, not the health department, but we as parents and adults, we're the ones bringing COVID to children. So I wanted to take it in a little different direction in talking about the importance of us getting vaccines. It's not just for us. The little girl who had the encephalitis, who's been hospitalized for 7-8 months, her mother said, I only wish I had gotten the vaccine. So I'm telling her story so that other parents don't make the same mistake that I made. You're on mute, Dr. Jarrett.
Thank you so much. You touched on the mistrust of the vaccine and the misinformation. It's definitely been difficult. We have celebrities and people who do have a public platform who are willing to speak up and share misinformation. So how do we help families and the community resolve the hesitancy that they have? Can you all share examples or just tell us how we can do that?
I think Dr. Matson is up.
Yeah, I had my hand up because I wanted to comment on some things that Dr. Regina was saying. And one of the things is in regard to our children. First of all, when I got vaccinated, I made it a point to get my 16-year-old son vaccinated as soon as I found out he was eligible, because it doesn't make sense for parents to be vaccinated and eligible children not to be vaccinated. That is, I won't use that. I'm sorry. It's stupid. I don't know. I don't know what better word to use. I'm sorry. I apologize. But it just doesn't make sense for me to be vaccinated and not vaccinate or protect my child. I require that he wears a mask in public. And my child and I are very outgoing. We like to go places and do things. And when he was on COVID lockdown, I thought he was going to drive me crazy. You know, autism kids are supposed to be antisocial, but my son was like, I want to go to summer camp. I want to go to somewhere. I want to get out of here. You know, I'm ready to go. Mommy, I want summer camp. Mommy, I want airplane. Mommy, I was just like, oh my God, he's going to drive me up a wall. So as soon as we were vaccinated, the first thing I did was put him on a plane and fly back home to Atlanta to visit our family. Then after we got back, I put him in 2 summer camps up in Randleman, North Carolina. I put him in 2 camps, and we drove up there for 2 separate camps because it's important. And now that he's in school, you know, I feel better about him going. I make sure he has his mask on. And because he's in a self-contained classroom and LRE, he's a least restrictive environment. He's not as exposed as other kids. But what I will say is I'm going to give an example so that this will hopefully help somebody. One of my church members came to me last Sunday or Sunday before, and she said she was going to the funeral of one of her son's good friends. And she said, this is how it happened, Pastor. The kid went to a school where they were fighting about mask mandates. And so the children were consequently not wearing masks. The daughter contracted COVID from someone at the school, unknowingly, brought it home, and the parent was infected, and the parent died. So, and then just this morning, and my friend who used to be a Christian chapel may know this person. Just this morning, a friend of mine called, and she's on here now, and told me that one of the prominent insurance providers here in Wilmington passed of COVID-19 just this morning. Hank Brown. And so I was just, I was dumbfounded. And then when I learned that he had refused to take the vaccine, I realized that's part of the problem. And I'll say this last thing and I'll be quiet. I have a very good friend who's a chaplain over at New Hanover Regional Medical Center. And she's also a pastor. She called me one day just to talk. And she said, I need to go on vacation. I need a break. And I said, okay. So she just started talking to me. You need to pray for me because I'm going through 90% of the people in our ICU on ventilation are people who refuse to have the vaccine. And then she went on to tell me that we have a married couple on the ventilator and their newborn child in the NICU, all because of COVID-19. So if this is not a serious condition, if this is not serious, I don't know what it's going to take to convince people how serious this is. This is just unbelievable. I've never seen anything like it in my lifetime.
And I was going to follow up that is exactly how, for me, where the new issue is, what it was, W.B. Yeats once famously said, think like a wise man, but speak in the language of the people. Well, I'm not sure that we are where the people are on the Dr. TikTok, on some of these social media things where they're getting all this crazy information from. So listen, you asked, how do we combat? I don't know how to combat a Nicki Minaj. Last time I checked, I didn't see a PhD, MD, RN, or any of that stuff. But it's interesting to me that you would listen to a Nicki Minaj about vaccine hesitancy, or listen to some of the other things like Megan Thee Stallion, or other folks who are talking about taking a horse pill, right, to fight, or that fights worms, because ultimately this is going to help you with your COVID. The interesting thing is the facts actually have already said that none of that is true and none of it works. But this is where I say to people who say they're anti-vax, I go, well, how are you going to be anti one science and pro another science? And where's your evidence? You ain't got no evidence. All you got is what you want to believe. So don't come to me, Nicki Minaj. Listen, I don't really know. I'm sure my son or daughter knows some Nicki Minaj music. I got to apologize. I don't really know. But it is crazy to me that we would believe that. Now, I would actually point out to you that this has been a conversation from the 1960s going on with Brother Malcolm and other things, who would say, how come with African Americans, when we're turning to actually facts and all these things, we turn to our entertainers and our athletes? Jewish communities, Asian communities, they're not usually turning to their athletes and their entertainers for information such as this. But what is it about us that we would believe a Nicki Minaj as opposed to looking at some of the doctors and nurses and health professionals in the field? It boggles my mind that a Nicki Minaj or Cardi B can tell you, well, tell them the truth why you don't take vaccines. Well, because, you know, they know that it's experimental. In fact, I was like laughing, Dr. Milter, about the peanut butter jelly sandwich, because you're right. I don't really know what's up in that, but I do know that both Pfizer and Moderna and Johnson & Johnson, because I've done this, have given the ingredients of everything in those vaccines. So when you've been as transparent as possible and people still won't take it because they are listening to a Cardi B or a Nicki Minaj, something wrong.
And some of these same people drink alcohol at clubs or vape or use other drugs that we don't know what's in them.
And when they get sick, y'all know the truth. I get to see it right in my, I'm just, listen,
And not to mention the fact that before my son goes to school, he has to have vaccination. A vaccination record has to go with him wherever he goes to school. He has to have the MMR, he has to have this, he has to that, you know, and then they make me give him the flu vaccine every year. So my thing is, why not? Why not protect the child in that regard? I mean, I took my shot way back in March, and people were talking about I'll be dead in however many weeks. Well, I'm still alive and kicking.
Yeah, and I think Dr. Nguyen has heard me say this before. When I was doing clinical medicine, I have given many a vaccine, as you have, Dr. Jarrett, to that cute little 2-month-old, 4-month-old, 6-month-old. Mom puts the baby on the table, holds the other leg, and you give them the vaccines that are needed. I have never, ever had a mother ask me what was in that vaccine. You say, I'm giving a DPT, and they're good. They don't say, what are the other ingredients? You know, what are the stabilizers, et cetera. So I'm really confused about why everyone is excited about what is in the COVID vaccine. If you really read the history of the mRNA vaccines, that work started back in 2003. This vaccine is not new. It's just new using the antigens and tissue samples to develop from COVID, the antibodies, but it is not new technology. And I'm excited that the technology that was developed in 2003 was available. And that was why the vaccine could come to be in so much quicker than vaccines that we've had in the past. The technology keeps improving. And the other thing is, I think Dr. Nguyen hit on it, you hear different information and you say, oh, the scientists are confused. They said this yesterday, they say this today. It's not that they're confused. They're giving you the information at hand. And as they learn more, they tell us more. So the information is changing. And I'm excited that the information is changing, that they're still looking at the vaccine. The only reason we don't have the vaccine for the 5 to 12-year-olds and then those under 5 is because they're taking their time. They're looking at the data. They're making sure the vaccine is safe. So when that vaccine comes out, I have a 7-year-old grandson, and that's why I'm particularly interested in this. He's back in school. I want what's best for him. And I've already talked to my daughter. She doesn't always listen to me because, you know, I'm grown, Mom, I got this. But when it comes to him, she doesn't make a move unless she talks to me. So we talk constantly about this. And so when that vaccine comes out, he is going to be in line. And that's, you know, my flesh and blood. Love nobody else more. That's my little man. So he will be in line. This vaccine doesn't know your political beliefs. It doesn't know whether you're Republican, Independent, or Democrat. It doesn't know whether you're rich or you're poor. It doesn't know whether you live in the country or the city. This is the most non-discriminatory, I guess, thing in our society right now is this virus. So it's not about beliefs, it's about the science. And it's about saving lives.
I love that, because honestly, you're not going to believe it away. Just like you're not
No.
going to believe cancer away.
No.
You're not going to believe COVID away. And so
No.
this is where you come down the whole thing about this issue that facts don't necessarily have to be at war with your faith. This is not a test of your faith. This is really not a test of your faith. I mean, early on, I remember back in March and other things like that, we were like, well, I just believe. We understand that science is nothing more than just new knowledge that comes to us. And now that we have the knowledge and the facts that over 12 million people or something, I think it's over 650,000 people nationally have died. We should be embarrassed. And I'll tell you one quick reason why we should be embarrassed. In 1918, that's over 100 years ago, we lost 175,000 people to what was called the Spanish flu. Mm-hmm. You mean to tell me in 100 years we didn't get smarter? We're at 650,000 right now. And what's saddest about this is that in 1918, I'm going to give them a reason why 675,000 people was lost. They barely knew about bacteria, let alone viruses. We know better. Maya Angelou said, when you know better, you should do better. Well, we know better. The question is, why aren't we doing better? And I think that it comes down to this connectedness about getting the messages out to people probably more effectively. And I'll take as an institution some responsibility that as a science has grown and as a science has actually developed miracle cures, like in my lifetime, I never thought we'd be talking about mRNA vaccines. I mean, and how much more effective they are than the traditional vaccines we've had. I never thought I'd be talking about, really making people thrive with breast cancer and I never thought I would see that in my lifetime, and yet I am. But the problem is that it's been those miracles of science have been unequally distributed. And so our communities, right, don't always benefit from that. So we really do have to get back as a health field, and I'll take some responsibility. I talked to Dr. Fauci about this too, that how are we going to build back trust and get our trustworthiness? Because at some point in the 60s and 70s, I remember if your doctor said, do it, you just said, all right.
Right.
Now all of a sudden you got Nicki Minaj telling you what to believe. And she would be all mad with me if I went up there and said, well, listen, your B flat was just a little too flat. We should probably put an A sharp in that. And then say, I don't know nothing about no music. But if I went in and telling her about her music, they'd be all upset. Well, I'm upset that somebody without any degrees, without even any background or frontline experience, is trying to tell me about how to do my business and confusing young people and other people about what to do, what's right. So,
yeah, it does get very frustrating to be in medicine right now and have these conversations with people when they want to quote other people who don't have any background in medicine.
The other thing that's
or science.
Yeah, the other thing that's going to be concerning is that the healthcare system is overwhelmed now. Everybody is tired. We've been lucky in the United States that we have the supplies that we need, but there's already discussion about in some states where they're being selective on who they're treating and how they're treating because they don't have enough of the facilities. So if that becomes a part of medical care throughout the United States, guess who's going to get caught short? It's going to be us. And the same thing with all disparities in healthcare. So it's important for us to prevent this disease in our families, in our communities, in our schools. So again, it's more than just a one-pronged problem.
So the next thing we want to talk about is asymptomatic COVID. Can someone speak about what asymptomatic COVID is?
Just real quick, For me,
Mhm.
asymptomatic COVID, as African Americans, we should know this one really well, right? And others, because asymptomatic COVID is a little bit like racism with people, right? They don't know that they hurting you. They're like, well, I ain't do nothing to you. I feel good. What you mean I do something to you, right? And we complain all the time, right? Asymptomatic COVID is a lot like that for me. You feel good, right? But you don't understand that by being unvaccinated, instead of infecting, maybe even if you're vaccinated, maybe your rates of lower of giving it to someone else. We now know about breakthrough and all the rest of this stuff. Your rates of giving it to someone else, we thought was zero. That's not true. But it turns out that it's a lot lower than the 20 to 25 people when you're infected and you're feeling good and you're asymptomatic, but you're a COVID carrier. So we know that this isn't the first virus that sometimes you get infected, you don't have symptoms, but you can spread it to other people. We know that this is historically something that happens. The nice part about the vaccine is that even though I give it an A in keeping you from being on a ventilator, keeping you from dying, I'm giving those an A. We wished it was an A in this issue of whether you could give it to other people. We thought that in the beginning that what was there we could prevent, but we now know with the mutations, it breaks through. And the reality is, but the breakthrough is much smaller. I mean, let's think about this. This is not an issue of asymptomatic vaccinated people. This is a pandemic of unvaccinated people. Let's get it right. 99% of my bed, 99% of the occupants in my bed right now, unvaccinated. This is not a story about the vaccinated. So asymptomatic is you feel good, but just like anybody else, and I was talking about my grandmother, but talk about racism, you feel good too, right? The people who are importing that on us and saying, well, what you mean there's a difference between black and white? They should be all right. I'm good with it. Ain't nothing wrong with me. Same thing with asymptomatic COVID. You have it, you test positive, and then ultimately you were able to spread it to other people. And I think that has been the real problem with the story that we've been talking about, that people don't feel great, but they're carrying it home, or they're carrying it to loved ones, or they're carrying it to people that they work with. And I don't mind about freedoms. I like freedoms. In fact, I enjoy my own personal freedom. But the funny part is freedom also comes with responsibility. I was thinking back in World War II, when the Germans were bombing all of England. And they said at the night, what did they say? Turn off your lights. Because if you turn off all the lights, the Germans won't be able to see you. They won't be able to easily pick out targets. Imagine if your personal freedom said, well, I don't really care. Your light was on and they're able to target your community. And so not only do you get blown up, but everybody else around you. That's a little bit about what's happening now. So this argument about personal freedom also is kind of, not all that solid either when you talk about what's your responsibility for those freedoms. But that's asymptomatic in a nutshell. Dr. M, did I do okay job? Dr. Matson,
Great.
Dr.
Yeah, you did.
Yeah, great job. But that also is a plug for wearing masks, and that's why it's really important to wear masks, because you can have COVID and not know it. So that's why we put the mask back on. Would you like to say something else,
I'm sorry,
Dr. Matson?
I was going to say, I actually made that comment to one of my son's workers, because when Delta variant came, and he is Mr. I refuse to do needles. I don't do needles. I don't like needles. And he never wanted to wear his mask. He wore his mask until I took his temperature, because I still do temperature checks at my house. And and so once he gets his temperature checked, he used to take the mask off. And then when the Delta variant came, I said to him, Jaden and I are vaccinated. You are not. I said, we could very easily give you COVID-19 and you could die. And guess what? Mask wearing came back, and now he's, but he needs to take the needle. I'm sorry, but okay, I'll take the mask, but you need to take the shot, son.
You know what, Dr. Matson, what's funny about that? Folks say they're afraid of needles. They got all these tattoos. I'm like, quit playing with me. Quit playing with me. You can't talk about you afraid of needles and you're going to get your whole arm all tatted up and talk about you afraid of needles. Stop.
Or are you scared of needles and you
playing.
smoking cigarettes
Right.
and all?
You're like, I'm scared of needles. You ain't scared of needles. You love them. If you can get a tat, you can get a needle with a vaccine. Quit playing with me.
So I would like for you guys to tell me about an experience where you convinced someone to get vaccinated who was very hesitant to get vaccinated. If you have
I can go first.
anything to
I can
share.
go first.
Yes. Thank you.
I'll take that one and I'll leave the rest. And I'll be short. And I'll go back to what I said at the beginning. Because since I had COVID-19 twice, I was just like, I don't need to get the shot because, I don't want to get COVID again. I just don't want it again. I don't want them to introduce these little things in me and I'll get sick. And guess what? The first vaccination I had, I got sick again. I got the fever again. I got the shakes again. I got a headache again. And I called the hospital. And I said, oh my God, you got to help me. And they said, it should go away in 24 to 48 hours. It's okay. My fever was like 103. No, almost, it was going 100 and climbing. And they said, if you reach 103, come back to the hospital. And I said, okay. So what I did was I went into defense mode and I started to do what I did when I had COVID. I tracked my temperature every hour and I would take Tylenol 1 hour in 4 hours. And 4 hours later, I would take Motrin. 4 hours later, Tylenol. By the time I got to the third round, my fever had broken. So I didn't have to do it anymore. And the chills went away, thankfully. And, I got back to normal. But I say that because I gave the testimony to my church. And the testimony that I gave to my church was when people were receiving emails about receiving the shot. Excuse me, I had already made up my mind that I was not. And my church members had already decided they were going to come by my house and make me stand in the front yard and touch the hem of my garment because I had survived COVID twice. So once I got the email that said clergy are now eligible, even though it wasn't, they were doing it by age, right? But they broke the rule to get clergy in. So they had done a certain age group, and then they said clergy are now eligible to get the shot. And I thought, I forgot. I'm clergy, and I am in contact with a lot of people. So just like I wear my mask to protect myself and them, I need to take the shot to protect them and myself from getting it a third time. So I went ahead and took it. And then I gave my testimony to the church. And one of my members who had said the same thing, I said, I'm not getting the shot. I'm coming to touch her garment. She went out and got her shot. So, and then others followed suit. But that's my testimony on how I convinced somebody else to get it. I hope my doing this today can convince others. I really do.
Thank you. Does anyone else have a story they wanted to share?
I just have a quick one with not so much me, but the two quick ones was that I had my uncle in my family who I got my grandmother vaccinated, my mom and everybody else. But my uncle, I convinced as a cancer survivor that he should get vaccinated, and he did. The interesting story about that is that his wife did not, and his kids did not. My aunt, who's married to him, after 20 some odd weeks, just got out of the hospital with COVID. My cousin actually spent about a total of 8 weeks and had just had a baby, by the way, and was out of commission. I think that alone actually induced and was a catalyst for getting the rest of my family vaccinated. But while it's a happy ending, I have to say that I was also very disturbed that we are now at a point where you actually literally have to touch the fire, get burned by the fire to be able to say that I'm going to do something. That to me is interesting because we always imagine ourselves to be very good in the context of critical thinking. As African Americans, we stood up. We have some of the best HBCUs and all the rest of stuff. We've gone to college, right? So what drives someone that says it's hot? If you touch that stove, you're gonna get burned. And say, well, I'm gonna touch the stove anyway. Then you get burnt. Then you all of a sudden you want to say, how do I get killed? The second quick one was Francis Collins. I had him at what we call the Facts and Faith Friday. Every Friday since March 2020. From 3 to 4 p.m. Eastern Standard Time, we have Tony Fauci, we've had the First Lady on, but it was actually the testimony of the guy from the NIH, Francis Collins, who moved the minds and said, listen, I wasn't a person of faith at all. I was a man of science. But as I understood that as science was making some things, I stood with one of my patients, and at the side of one of my patients who was a dying woman with cancer, she brought me to faith. And now that I actually have the faith, it is my rock and my solid, and it is not at war with his science. In fact, he pointed out that the little amino acids that we all know, the A and the C, and the A to T and the G and the C, those building blocks of humanity was one of God's evidence of his power and domain of being able to bring us about. Turns out that after he said, and people said, well, I've seen this guy on TV, it was trust. And if this guy is sort of saying this is how this came about, it didn't come about with the vaccine just because it came about. You had people like Fauci, but you had people like Francis Collins, the head of the NIH, who were pushing this. After that, after that Facts Face Friday sort of event that we have every Friday, we actually had 75 people and their family members sign up to get vaccinated. So I think it's the power, like Dr. Matson and Dr. Milter are saying, the power of your own testimony and hopefully reaching other people that's going to get people to be vaccinated. Because just telling folk, the folks who you just told and the folks who use the analytical knowledge, they already got vaccinated.
Right. Very true. So there seems to also be a surge in RSV, and I'm going to let Dr. Milter speak on that.
Yeah, that's
in
my
children.
yeah,
Is that related to COVID? And can you tell us a little bit more about RSV?
RSV is a respiratory virus, upper respiratory infection that is more symptomatic in young children because they have more narrow airways. When I was in the hospital, after my first case of RSV and maybe my second, I think I developed an immunity. But now if I am around somebody with RSV, which I have been about a year ago, I cough for 6 months. I didn't get it to go away. But it is an upper respiratory tract infection. RSV usually moves from the West Coast to the East Coast. It starts in September, October, and usually by the time it gets to the East Coast, late October, November, and we might peak after the holidays. This year, because children have been locked up and now they're out and about, RSV has moved a lot quicker, and we started seeing RSV infection on the East Coast as early as April and May of this year. Now that school has opened, RSV is just having a great time, and hospital beds are filling up. I talked to a friend recently, and most of their inpatient beds, not ICU beds at this point, are young babies with RSV, and they usually come in this time of year, maybe a little bit later. They may have a moderate to mild course. Some of them do end up in the ICU, but COVID is not causing RSV. Just being quarantined and locked up for 18 months, RSV didn't get a good hold on the community last year, nor did flu for that matter. But now everyone's out and about, so RSV is just having an earlier season. It's not a virus that's associated with COVID at all. The only thing that's different this year is the timing.
Thank you very much for that. So should we be concerned about how many schools, churches, and entertainment venues are having indoor and outdoor events? Are there specific issues with indoor and outdoor events that you guys would like to speak to?
I'm gonna let somebody answer that. I'll get myself in trouble because I definitely have an opinion. So I'm gonna just stay offline until I'm gonna hear from everybody else, because I definitely got an opinion, but I'm gonna hold it for now.
Okay.
I think, like you, Dr. Nguyen, I have an opinion. When I was looking at television the past 2 weekends and I see the stadiums full and nobody with masks, I just kind of cringe. We can all show vaccine cards, and we know that all vaccine cards shown are not legitimate cards. And we know that one can have a negative test today and become symptomatic in the next day or two. So, I'm still avoiding large crowds. I don't know about the other panelists, but really, really being careful about large crowds. I haven't been in anyone's house other than my daughter's in like, what, 18, 19 months? And nor has anybody been in mine other than my daughter and her little family. They're in our bubble. So I don't know. I guess I'm like Dr. Nguyen. I have a strong opinion and maybe I will keep the rest of my opinion to myself.
I appreciate your opinion. Thank you.
Mhm.
What would you like to say, Dr. Matson?
Well, we are still doing temperature checks at church. We still have social distancing. We will not allow more than 25 people to gather at church. We still are doing the virtual option. And I have told my congregation, if you don't feel comfortable, do not come. Stay at home. Do virtual. And we have double the amount of families, because, participants can be anywhere from 1 to up, on Zoom. So we have twice as many participating on virtual service as we do in service, and that's fine as long as people are getting the word. As far as gatherings go, I think I said I put my son on a plane as soon as we could, but the airlines do a really good job of making sure people stay masked and all of that, and we followed those. And because my son has autism, I wrote a social story to let him know you got to keep your mask on, you got to do this, you got to do that. And so that helped. And then when I put him in the summer camps, the camp that I put him in is an autism camp, and it's for families. You go together and they only keep you together in your cluster. So, you stay in your bubble, you have your own cabin. They make you social distance. You must wear your mask when you're indoors and around others, and you eat your meals in your cabin away from others. So that really worked well for us. What I will say as far as family goes, my family, as I said, I'm originally from Atlanta. I've been living in Wilmington for a long time, but I'm originally from Atlanta, and we are definitely party people. And I don't mean that like, Cardi B party people. I mean like, we celebrate all the time. Hey, you got straight A's? Let's have a cookout. Hey, your birthday's coming up. Let's have a cookout. So we've been like that all our lives. And so my family, even though my mother is deceased now for 2 years, my family is still doing these things. And I told my sister, who is hosting all these parties, and was doing it in the midst of COVID, y'all are going to give out COVID with 2 pieces and a biscuit. And she said, no. And I said, I'm telling you, you are not doing temperature checks. You're not making sure people wear masks. Every time I look at you on Facebook, everybody's grinning with no mask on. What is going on? I said, I'm talking to you. It's somebody who had COVID. But are you coming home? No, I'm not coming to your Petri dish. I'm not coming. And so I finally went home this year in May because my brother turned 50, and I went home to celebrate, and I had to go straight from there to my graduation at Duke because I got my doctorate at Duke, and we had graduation this year, right? Thank you. And so I drove to Atlanta. I left Atlanta, drove straight to Durham, where we had our socially distanced, no invitees to the graduation, all virtual, so family members had to tune in on Zoom. And I said, look, we're doing this on Zoom. So that was my first time going. I only went because it was my brother's 50th birthday party. And I made sure I was very cautious because I knew there were a lot of people who would be there. And so, this year I've told them I'll probably do what I did last year, and that's stay away from y'all. Because, Delta variant is real and it's not anything to be played with. And, if you're not going to temperature check and make people wear masks, I'm not coming. It's not going to work for me.
Like Matson,
We
I
have
think
an
that
audience
it is
question. I'm going to have to ask the audience question, which is, how do people contract COVID multiple times if they've already had the vaccine?
Oh, now I didn't have the
I think
vaccine.
we've spoke on that before, but
Yeah.
Yeah.
Maybe
So here's the deal. The reality is, this is like asking, why do you get the flu vaccine every year, right? So the truth of the matter is, we know that once you've gotten the first vaccine dose, well, let's talk about people who just had COVID. So you just got COVID, you decide not to get a shot because you have antibodies. Well, the antibodies that you have may not be actually very effective against the new mutants that are coming. How do we get mutants? You can only get mutants of COVID from large groups of people who don't get vaccinated. So we know the decimation of the Delta variant. We saw it right in front of our very eyes in India, how it decimated India. Well, the interesting part is it didn't just stay in India, it tracks. So as you're talking about how does someone get it again, the truth of the matter is even with the vaccines, while we're talking about full vaccination, it's like if you had a raincoat, but you didn't have galoshes and you didn't have a rain hat, you could still get wet, right? So what the full vaccination allows you to have the rain cap, the coat, and the galoshes so that you have less chance of rain getting you. What is breakthrough? We talked about this. So breakthrough means that you've gotten that vaccine in January, but every vaccine tends to actually, become less and less effective over time. The longer you wait, right? That's why you need another shot. That's why this whole conversation about the booster, when to get it, all the rest of that, but that's another conversation. So the reality is if you come in contact with a person who is very floridly positive COVID-19, even if you had your vaccine, it doesn't mean that you can't get COVID, but what does it do? The COVID vaccine is acted exactly like it's supposed to do. It never said that you can't ever get COVID again. But what it said was that if you got exposed to COVID and you got it again, you wouldn't be on a ventilator. Your risk of dying would be so much less. And in fact, that, you may even get a little sick, but you would definitely survive and have a better outcome. It never said that you can't get COVID. It said that if you were able to be reinfected with COVID, that you would be much better off with the vaccine than if you're unvaccinated. I hope that helped.
Thank you very much for explaining that. I know that is a question that a lot of people have, and in a way that people try to convince themselves they should not get vaccinated. But I really appreciate you speaking to that. The fact that most of the people who get really sick are the ones who are not vaccinated, and it's really important to get your vaccine.
And the funny part about that is that, not to get all epidemiological with this, but I'm gonna get it for just a little bit because I'm actually starting to earn a little bit of this data. It's something called base rate. So if you have 98% of the people vaccinated, of course you're gonna have a couple breakthrough cases,
Right.
But then you have to look at the rate of the unvaccinated people who get sick versus the vaccinated. So in the case of the vaccinated, you're talking about 3 out of 1,000. This is coming from Greenland. If you talk about unvaccinated, 15 out of 1,000. And so it's not the same. It really is true that unvaccinated people are at an 11 times higher rate of getting COVID and having a poorer outcome. That's facts.
Right. So we have run out of time. I have really enjoyed talking to you all, and I think we could do this for a while longer, but we're out of time. So I normally give everyone just a few seconds to leave one thing, one tip of wisdom that you would like to share with the community listening. We'll start with you, Dr. Weir.
Get vaxxed. Get vaccinated. That's my only thing.
All right. Perfect.
I want to agree, especially if you have children, and make sure your children get vaccinated if they're eligible. The only way we can get rid of the pandemic, because the virus is going to be with us forever. We've had coronavirus in the community forever. It's not a new virus. It's just a new behaving variation of the coronavirus. Get vaccinated and make sure all of your family members do as well.
Thank you very much. Next, Reverend Dr. Matson.
I echo the sentiments of both the doctors, but I will say this: while Dr. Nguyen was speaking, I thought about the fact that we get the flu vaccination and still some people get the flu. So it's no different. It's just that, you won't die if highly unlikely that you will die if you get the vaccine. So please vax up and mask up.
Thank you very much. I appreciate that. And I just would like to reiterate what they all said about getting vaccinated. And I didn't get to share my story about convincing someone to get the vaccine, but I have the most success when someone in the family has already talked to my patient about getting the vaccine. So keep talking to your family members and trying to convince them to get the vaccine as well. Please complete the short survey that we have on the Facebook chat at the end of this conversation today. And thank you all for coming to join us on the Talk on Health. Bye.